All right, so good evening, everyone. Thank you so much for spending a little bit of time with me this evening. I'm Bruce McFarlane. So we want to talk to you about what's going on right now, March the 1st, 2017. And the two big words that are out there in the tooth straightening world are, of course, they want it well done, and that's kind of a given. That's the entry level. But they want it invisible, and they want it fast. And so that's what we're going to address tonight. And we're going to show you ways to do this to make your patients happy, both invisibly and fast. It's been fairly recently now that I've been able to look you right in the eye and say Invisalign is now equivalent to braces. And my thinking has really changed because a case like this, I really, even about 2.5, 3 years ago, I wouldn't have imagined that we could do this all the way with Invisalign. I was doing a fair amount of, we put braces on first, get the tough stuff done, and then transition them to Invisalign. But this particular case, went from there to there in about a year, and now, as we'll see, we're actually thinking about getting it faster. And now, a case like this, in my office has actually become, it used to be, well, we could do this in braces or we could do it in Invisalign. Now, this Invisalign is the treatment of choice for this sort of malocclusion. And the key is the awesome vertical control that we have with Invisalign. A fair number of aligners and a fair bit of need for cooperation and that sort of thing. But we're able to take this guy in 22 aligners. And we close them down, and it's through a combination of intrusion of the posterior teeth, and then you can see these attachments here are for extrusion of the anterior teeth as well. And then, of course, along the way, we're expanding these cases as well, and also talking about things like tongue posture and that sort of thing as well. So what's new? There's always something new with Invisalign. In fact, this week Invisalign actually announced a new version of itself. There was, we've been through Express 5, 10, Assist, and Full, and Teen Invisalign, and now there's Invisalign Lite as well. But there's been a few sort of revolutionary things. We're going through all the Gs here, and one of the neat ones in my practice is G5, and because I see a lot of deep bites, and we see a lot of later onset deep bites too, like people who have relapsed, or they've got the big brachyfacial type, and they got the big masseter muscles, and their bite is getting deeper and deeper as they get more time enhanced. We don't call them aging or older. Yeah, you can use that one if you like. But it's been kind of neat because in fixed orthodontics, we use things called bite turbos, which are basically these ledges that we put on the inside of upper incisors. The lower incisors hit them first, and therefore that helps to intrude the teeth. Going through the Gs, the next level, G6, has to do with space closure, making it more predictable. And so in extraction cases or cases where we want to close large spaces, we will use these special attachments, and it's all about controlling anchorage and, as much as we can, make the movement bodily. G7, some people think it's the 7-day intervals, which kind of came out at the same time. But G7 is kind of a whole new ideology with regards to making the attachments more efficient. And those of us that have done a bunch of Invisalign know, especially upper lateral incisors seem to struggle with tracking. So they've really worked on that and come up with these multi-plane attachment combinations for solving that and making those movements more predictable. Just because there are great capabilities with Invisalign, I kind of caution you a little bit on case selection and encourage you, like anything that you do in dentistry, especially at first, to kind of be careful about what you're taking on, and that way you'll be much happier. You'll be much less frustrated, and the cases will finish quickly and nicely, and the patient will be your friend, and you will actually make some money on it too. So, like a case like this, it's kind of like your first implant case. You don't necessarily want to do a sinus lift with the bone bone graft from the hip or something like that. But it's kind of the same idea. These are pretty tough cases, and there's a lot to them, and they take a long time as well. So I encourage you, although this is possible with Invisalign, absolutely, we went from there to there. In your practice, and you must be the person who makes that decision, but I'd sure recommend that, that especially at first, that you not sort of take on this sort of a case, even though it's possible. And gosh, there's so many of them out there, and if you talk to your hygienist, do you talk to your hygienist at all? Okay, okay, good. Fair enough. So here's a terrific example, and she had orthodontics before, and sure enough, she has relapsed. So this lady, she's going to have 10 aligners, and that actually is within the Invisalign Express category, and she is going to go from there to there. So here we are, 4 months later, and she's done. We did not have to case refine her, and we got a nice little decrease in the depth of her bite. Her lower incisors unraveled, and we got a pretty decent occlusion out of our 10 aligners. So that's what the ClinCheck said should happen, and that's what did happen, so pretty darn close. And we went from there to there. This is the thing that I mentioned about the attached gingiva. Actually, it seemed to be quieter. That's what I think of. Maybe a little more harmony in their occlusion, and also for 4 months, she's not, been able to brux and clench and that sort of thing. So we're treating now polio, diabetes. We're regrowing limbs with Invisalign. It's exciting, yeah, for sure. And now faster too, Jonathan. Yeah, your leg will grow a lot. Not ED though. No.